Poliomyelitis. Polio has been eradicated throughout the globe except few countries, and Pakistan is one of them. Polio is still present in Pakistan. So government is trying to eradicate polio from Pakistan. We will discuss this session according to following learning objectives. First, we will define what is polio. Then we will discuss the epidemiology of polio virus. What are various risk factors of polio? Then we will classify. We will discuss clinical features, assessment of poliovirus, diagnosis, management of polio, and then we will discuss polio eradication and endgame strategic plan. Then we will discuss polio surveillance. In the end, we will summarize the session. So let's start. Polio or infantile paralysis. It's an infectious disease that is caused by a virus. It's a virus of enterovirus subgroup of Picornaviridae family. It has three subtypes: poliovirus 1, poliovirus 2, and poliovirus 3. The tissue which is most commonly affected is the spinal cord, which leads to classical manifestation of paralysis or which can cause paralysis. You can see that child is unable to walk due to polio cause it causes muscular weakness and paralysis. As a result of massive campaigns, global vaccination campaigns over the past 20 years, polio only exists in Pakistan and in Afghanistan. Even Philippines has eradicated polio and it has been declared polio free by UNICEF in the year 2005. Polio virus transmits via fecal route. So you have to remember fecal route. It is a common MCQ. And also it spreads from person to person or droplet infection. So there are two modes of transmission. Number one is fecal route, which is predominant. Number two, droplet infection, which is less common. What are various risk factors of polio? Infants and elderly, they are at high risk. Children and those who are elders have lesser immunity, so they are at high risk. Person who is living with an infected person, like a child is infected, mother is also at risk of developing polio virus. Those who have compromised immune system or lack of immunization against polio or extreme stress, they may cause polio virus. People who are traveling to an area where there is an outbreak of polio, they are at high risk of developing polio. So you must limit traveling to polio endemic or polio epidemic areas. As we have discussed that polio causes paralysis. Paralysis has three types: spinal polio, bulbar polio, and bulbospinal polio. Spinal polio is most common. It accounts for 79% of paralytical cases. It is characterized by asymmetrical paralysis and it often involves legs. It involves lower limb. Asymmetrical paralysis is present in spinal polio. And bulbar polio only accounts for 2 to 3% of cases. It causes weakness of muscles. Muscles get weakened. And bulbospinal polio is a mixture of both. It accounts for 19% cases. So most common is spinal polio, then bulbospinal polio, then bulbar polio. Polio has incubation period of 6 to 20 days. It may range from 3 to 35 days. It depends on response. It depends on viral load. Clinical presentation depends on viral load. Pathognomic sign is flaccid paralysis, weakness, or paralysis, and reduced muscle tone. So you have to remember flaccid paralysis. It is a common MCQ that pathognomic sign of polio is flaccid paralysis. How will we assess polio? There are many types of polio. Inapparent polio, which spreads by which has no signs and symptoms, or we can say that asymptomatic. Abortive polio, which spreads to droplet infection. Then non-paralytical polio and paralytical polio. We have to distinguish between them. In inapparent polio, there is no sign, no symptom. In abortive polio, there is sore throat, there is abdominal pain, there may be constipation, nausea, a loss of appetite. It spreads to upper respiratory tract. There may be pain. There may there may be imbalanced nutrition. There may be fatigue. So abortive polio is characterized by sore throat, abdominal pain, nausea, vomiting, fatigue. You have to remember this, and it spreads to upper respiratory tract infection, or it spreads to droplet infection. Non-paralytical polio. There is only stiffness or muscular weakness, and person may feel pain and hyperthermia. He may feel pain and fever. And in paralytical polio, it causes severe muscular pain. It causes paralysis, loss of reflexes, loss of superficial reflexes, and flaccid paralysis. And person may become disabled. There may be impaired breathing. So we can say that there is independent polio, there is abortive polio, there is non-paralytical polio, and paralytical polio. Most dangerous and most severe form is paralytical polio, because a person may become crippled, he may become disabled. We have to diagnose, so we have to do certain tests. Various tests are performed to isolate poliovirus. Number one is virus culture. Number two are serological tests and cerebrospinal fluid test. We have to do lumbar puncture. These are diagnostic tests. You have to remember their names only. Virus culture, serological test, and cerebrospinal fluid test. We can isolate poliovirus by performing these tests. Management is most important. When a person becomes infected with poliovirus, we can treat, we have to treat, we have to manage. We can do symptomatic treatment. If a person is having pain, we can give analgesics. Acetaminophen can be given. Why antibiotics can be given? Cause of secondary infection. We have to prevent secondary infection, because a person who is suffering from polio may get attacked by some other infection. So we can give antibiotics. We need to give fluids. He may suffer from dehydration. Bed rest. When a person is suffering from fever due to polio, bed rest is essential. It's mandatory. We have to improve the diet, so we have to give adequate diet. Nutritional requirements should be met. And there should be minimal exertion or exercise. Rest is advised. Hot packs can be advised to reduce muscular pain, because person may suffer from severe pain. We have to reduce pain, we have to reduce agony. And rehabilitation, that is most important step. Prolonged rehabilitation is required. We have to provide braces, splint, or we can do surgery. The rehabilitation has a role, because we have to rehabilitate a person to return towards normal life. A person becomes disabled, we have to give braces, splints. Other management include hospitalization. Some people who suffer from severe paralysis may need to admit. If the respiratory system is involved, ventilation is necessary. We have to do physiotherapy to increase muscle tone. And firm mattress. Child should be placed on firm mattress. We have to encourage oral intake. Oral intake should be increased. And if a person needs catheterization, it should be done because of descending bladder. We have to do catheterization of a person. This was management by bed rest, braces, rehabilitation, fluids, ventilation. These are the most important steps in managing polio. But best way to control polio is prevention. We can prevent polio. We can prevent polio by vaccination. Two types of vaccines are available: activated polio vaccine and inactivated polio vaccine. Both are given simultaneously nowadays. In Pakistan, both vaccines are added in EPA schedule. Polio days are celebrated. So we are trying to reduce polio. We are trying to prevent polio, and by doing vaccination. There are two types of vaccines: killed vaccine and live vaccine. Both have certain advantages and disadvantages. Let's discuss them. Inactivated polio vaccine. It is inactivated. It can't replicate, so it can't cause poliovirus. It can be given at any age. It can be given to immunocompromised people. Oral polio vaccine. It is easy. It is cheaper. And the best advantage is herd immunity. It is a university MCQ that herd immunity is provided by oral polio vaccine. This is the main advantage. And what is the main disadvantage? Oral polio vaccine is a live vaccine. It can cause vaccine derived or vaccine associated paralytical polio in less than 1% of cases. This vaccine causes polio. So now world is shifting from OPV to IPV. In Pakistan, we are shifting from oral polio vaccine to inactivated polio vaccine to reduce vaccine-associated polio virus. And this is the oral vaccine, easy to administer. 2 drops can be given. They can be given from birth till the age of 5 years. There are massive campaigns against polio. So vaccination programs are launched by government. Oral vaccine is given to every child from birth till 5 years. Inactivated vaccine or injectable vaccine, this is given to travelers or at old age. It is safe in pregnancy. It is safe for immunocompromised people, those who are immunocompromised can be given inactivated polio vaccine, but it is hard to administer. WHO has launched program polio eradication and endgame strategic plan to eradicate polio. This program is being implemented in Pakistan. What it has done? There are 4 important components of this program. Number one, polio virus detection and interruption. How we will detect? By serological tests, by virus isolation, by surveillance. And we have to give vaccine to interrupt the chain of transmission, to break the chain of transmission. Vaccination is being done. Like I already mentioned that oral polio vaccine causes herd immunity. OPV withdrawal. This is the next step. And we are in this step that we are shifting. There is gradual shifting from OPV to IPV. Routine immunization strengthening. Vaccination programs are being strengthened. Vaccination is provided to every child under 5 years. Government has shifted. Government is trying to shift from oral polio to IPV. So IPV is given at 14 weeks and at the age of 9 months. We are given IPV. So there is shifting. We are in shifting phase. Then containment and certification. We have to contain various polio viruses in the laboratory. Then WHO will certify. In the last 12 months, no case of polio virus is detected in Pakistan. So we are in a phase of eradication. Then legacy planning. What is this? We have established a system. We have trained our healthcare workers. Government is providing fund. So we have to do this planning, or we have to implement this, or we have to control other programs, or we can say that we can use these resources to control other diseases. This is legacy planning. Like we have manpower, we have funds, we have infrastructure. We can use this infrastructure in other way to control other diseases in a better way. When Pakistan becomes polio free, there should be legacy planning. So we are hopeful that we are getting rid of polio virus in future. Then polio surveillance. It is also a university question. Like polio eradication and endgame strategic plan is a common university question in Pakistan. Polio surveillance is also a common university question. How we do polio surveillance? What is surveillance? Surveillance is monitoring. This is a continuous process. We continuously monitor. So, number one, we'll consider every child who is less than 15 years with acute flaccid paralysis as a case of polio virus. We will consider this child as a case of polio. Then we will send 2 stool samples to laboratory. Which laboratory? Global Laboratory Network by WHO. Laboratories which are authorized by WHO. We will send 2 stool samples to this laboratory. And then we'll try to isolate polio virus. In case polio virus is not isolated, we'll say that child is polio free. But when polio virus is isolated from stool, we'll do environmental surveillance. We'll go to the area from where this case has come. We'll do surveillance, we'll diagnose, we'll do screening to detect polio cases. We need to detect polio cases in other children also. So this is a continuous process. Now there are few terms which may be asked in examination: line listing, mopping up, and pulse polio immunization. What is line listing? We have to Centrally registered polio case. Our polio cases are centrally registered. While listening is central registration of polio case. Why central registration? To avoid duplication. Central registration is done to avoid duplication. Mopping up. Door to door immunization. Polio teams go door to door and immunize the children. Pulse polio immunization. Polio days. Polio days are celebrated at government level. Every year there are few polio days. Aim is to eradicate polio from Pakistan. Aim is to vaccinate every child. Aim is to achieve herd immunity. Aim is to achieve polio free Pakistan. So these days are celebrated. We have to do line listing because we have to avoid duplication. Then door to door campaigns. These are massive campaigns to reduce polio. But still, polio is present in Pakistan. Why? There is a question. Why polio is still present in Pakistan? In spite of massive vaccination campaigns, in spite of massive vaccination, every child is vaccinated. But why? Why polio is still present? This is the burning question. Number one, political instability. Why? Because governments change rapidly in Pakistan, policies change rapidly in Pakistan, new government comes, forms a new policy. That's why there is political instability. Number two, lack of awareness. People don't know about polio vaccine. There are a lot of myths regarding polio vaccine. Pakistan population is distributed from hilly areas to grounds. So, due to massive area of Pakistan, lack of communication. Why lack of communication? Healthcare workers fail to communicate with parents, fail to communicate with community. There is community participation, lesser community participation. People don't believe, they don't participate. Without active participation of community, this can't be controlled. Polio can't be eradicated until unless community is involved. We have to involve community. We have to educate community. We have to create awareness. We have to create coordination. We have to create communication between people and healthcare workers. There is a gap. Even there is lack of education in healthcare workers. There is lack of training. Healthcare workers are not trained properly. So they are unable to meet with the myths. They are unable to coordinate with people. There is a fear factor also. People have been killed. And there is terrorism in the country. Due to bomb blasts, due to so many terrorist activities, it is not eradicated. And then, immunocompromised children. Child may be immunocompromised. He or she may be suffering from diarrhea. So polio vaccine is not effective. Cold chain is very important. What is cold chain? Maintenance of vaccination from manufacturing till delivery. It may not be maintained by healthcare workers. So vaccine is not effective. So there are a lot of problems, there are a lot of hurdles, there are a lot of loopholes. We need to fill these bridges. We need to fill this gap. What is gap? Gap of education. We need to educate to control polio virus from the country. There is a migration factor also. Most of the cases of polio are migrated from Afghanistan. They are spreading polio in Pakistan. So there may be some check and balance. So this question, this is a common university question. Why polio is still prevalent in Pakistan? You can answer. You can answer political instability. There is lack of awareness. There is huge and massive area of Pakistan. It is hard to cover all areas. There are hilly areas, there are plain, there are far-flung areas. Majority population is living in rural areas. Lack of communication, lack of participation, lack of training. There is no community participation, immunocompromised children, migration, cold chain. These are the factors which are influencing. Although government is trying to provide vaccination to every child. Now we'll summarize the session. We have discussed that polio is a viral disease. There are three serotypes. Mode of transmission is very important. Fecal route. Polio spreads from fecal route predominantly, plus droplet infection. Or we can say that there is non-paralytical polio. There is abortive polio. And there is paralytical polio. What is difference between them? Non-paralytic polio may spread from respiratory route. Abortive polio just causes muscular weakness. Paralytical polio causes paralysis. Then we have discussed management. We can give painkillers, physiotherapy, braces, rehabilitation, hospitalization, respiratory support. Antibiotics can be given to prevent secondary infections. Then we discuss prevention. We can give two types of vaccine, IPV and OPV. We discussed that IPV is inactivated poliovirus vaccine and OPV is activated. Main difference is herd immunity. OPV provides herd immunity. IPV can be given to immunocompromised. It can be given to pregnant female. Then we discussed polio eradication and end game strategic plan. What is this? We have to strengthen polio vaccine. We have to shift from OPV to IPV cause OPV can cause vaccine-derived polio virus. Pakistan is in shifting phase. We are providing IPV at the age of 14 weeks and 9 months. This can be a MCQ that IPV is included in EPA schedule at the age of 14 weeks and 9 months. Then there should be containment, certification, and legacy planning. Resources should be used in some other ways, or we can use these resources. We can use this manpower in controlling other problems, other prevalent problems. These are the four important steps of polio eradication and end game strategic plan. Then polio surveillance. We have to consider every child under 15 years or less than 15 years with flaccid paralysis. Flaccid paralysis is a pathognomic sign of polio. Flaccid paralysis, so you can remember flaccid paralysis. So we have to identify polio virus from their stool samples. Samples should be sent to Global Polio Laboratory Network. Then there is environmental surveillance. Then we discuss why polio is still present in Pakistan. So from the last 12 months, there is no case of polio virus in Pakistan, or no case of polio has been detected in Pakistan. How we detect these cases? By screening, by surveillance. Then we discuss three terms: line listing, mopping up, pulse polio immunization. Line listing is central system of registration of polio cases to avoid duplication. For example, a person living in Koita has been detected as a case of polio virus. There is one case. He may migrate to Karachi. If there is central registration system, it is considered as one case. Otherwise, it can be duplicated. Then mopping up, there are door-to-door campaigns. Then there are polio days. So we can eradicate polio. Polio can be eradicated by vaccination. Cause it causes disability. Child may not be able to walk. It causes crippling. So we can control poliovirus by establishing coordination system, by community participation, by creating awareness, health education. That's all.